Hi, this is Dr. David Greene, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is, what are the 3 different types of epidural steroid injections? Well, epidural steroid injections have been a mainstay in pain management for over 60 years. And initially there was just one type, and that was an interlaminar epidural injection. So here you have a spine model, and this is from the back. These are the bumps that you feel, the spinous processes, okay? And these yellow things are the nerve roots coming out at every level from the spine. Now, if they get pinched, like you can see here, with this red area, a piece of disc coming out, hitting this nerve root, that's called a herniated disc, pinched nerve, and it can cause sciatica, which is pain down the leg. So an epidural injection of steroid medication, which is a soothing cortisone, can be very helpful for reducing that pain, okay, or eliminating it. An interlaminar injection is one that was placed between these 2 areas here, which are called the lamina, and pain doctors, orthopedic surgeons used to put the needle in this area, and they used to do it blind, meaning they didn't have the real-time x-ray machines like they do today, and that's called fluoroscopy. Well, there was a study done decades ago, and it showed that without fluoroscopy, 40% of those injections were put into the wrong place. So it's very important that your pain management doctor uses fluoroscopy or ultrasound or something to help guide where the needle goes. Okay? So those injections are interlaminar, meaning between the lamina, were very effective, but the key is to make sure they're being put into the right place. Okay? And those are effective over 75% of the time. Now, the second type of epidural injection is called a transforaminal injection. Now, you see where the nerve root's coming out here, this yellow thing? It's coming out of a hole, and that's called a foramen. So after it leaves the spinal cord in the epidural space, and then it comes out from the spine, that's called the foramen. So an epidural injection that is transforaminal goes into that area where it's coming out the foramen, okay? And the key to that is that it gets the steroid medication closer to the exact area where it's being pinched, all right? And that studies have shown that they're a little bit more effective than interlaminar epidural injections, but not a huge amount. So they're both very effective. Most modern pain management doctors will use often transforaminal in the lumbar spine. It's pretty risky up in the cervical spine, but in the lumbar spine, that's the type that most will use. Except there is a third type of epidural injection, and that is called a caudal, C-A-U-D-A-L. Now, a caudal epidural injection is placed from way low. So here you have the lumbar spine, you have the sacrum. It's actually put in down here in an area called the sacral hiatus, which is this opening right here. And what a pain doctor will do is they'll put the needle in and they'll inject a high volume of steroid medication, because by gravity it can actually move up and help get multiple areas of where the nerve roots are being compressed. Why would you do that? Why not just get the one area? Well, think about this. If you have a herniated disc at one level, an interlaminar or transforaminal, that's fine. That's all you need. But if you have spinal stenosis, where multiple nerve roots are being pinched because of arthritis and overgrowth of tissue, then a caudal can actually get multiple levels and provide pain relief at several areas with only one injection, okay? And that's called a caudal epidural injection. All 3 are very effective. Between 75 and 90% is what studies show, okay? The risk profile of an epidural injection is very low. It's less than 1% of infection or maybe a slight increase in blood sugars. Now, one thing that's been looked at is, are there other substances that can be just as useful as steroid? So far, the answer is no studies have shown that there is a substance that gives as effective as pain relief and for the long of duration, okay? So right now, steroid, and there's multiple different kinds. There's methylprednisolone, there's Kenalog, Celestone. Your pain doctor will have his or her preference, okay? But steroid medication to date, over the last 60 years, has been the key medication used. So there you have it. There's the 3 different kinds. I'm Dr. David Greene with the Nevada Pain Network. We currently work with Innovative Pain Care, which is the best pain management centers in Las Vegas and Henderson. They have 2 locations. They accept most major insurances, almost all PPOs, Medicare, self-pay, some HMOs. Just check our list on the website. It's painmanagementlasvegas.com. Call today. The number's right there on the screen. We'd be happy to get you some more information and get you scheduled for the best pain management Las Vegas has to offer. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.